Good morning, beautiful people. My healthy audience today. Hope everyone is doing well. We're going to get started here. If you don't mind, come on in, take a seat, grab a good one. I know, I think all the seats are good in this room, but we are going to get started. We waited an extra 15 minutes, 18 minutes. And definitely want to get on time. I know people have things to do, lots of agendas to hit today in terms of lots of conversation, great education, and a whole bunch of other good things. Well, good morning. This light is bright today. Guys, these lights weren't on yesterday. Can you turn them down a little bit? Or, whoa, I got blue. All right. Okay, well, nice way to wake up. Nice way to wake up. What can I say? Good morning. I'm Rachel Muleman, day 2 at Health 2.0. Who was here yesterday? Okay, it's great to see you again. Great to see you again. Good morning. Come on in. I see. If you didn't hear me when I begun, I said, good morning, beautiful people. I say the healthiest people in Dubai right now. It's a great day to learn and form connections. Day 2, you'll see people trickle in throughout the day. There's a lot of great agendas, topics today. We're going to talk about everything from patients to personalization to corporate governance to disease. We're going to be talking about a slew of different topics around health, and I'm so happy that you're here. I'm delighted to host it for day 2 and keep you engaged, keep you connected, and make sure with this group today we get a lot of new connections made. I see people buzzing around, talking, meeting new people, which is great. And so this is why we're here to connect, especially at this conference, Health 2.0 Winter Edition. Just to remind everybody, we're using all the social media platforms from Facebook, Instagram to YouTube. Right behind me, we are streaming live, so everybody could watch this on YouTube. You could always watch it after the show. It's a great way to refresh your memory of who you met, what their names were, and what they presented, because all of this is going to be accessible online. And it's a great way if you are getting up here as a panel guest for you to share that link on YouTube, and your friends back home, colleagues, family members, mother-in-laws, they could all watch as well, you know? So it's day 2, and we're using a hashtag Health2Conf. CONF. It's short for conference, but it's the same website you got on those table tents in front of you. Just in case you can't remember it, it's Health2Conf. Really easy. Use it so that organizers can pick up your content and share it. So I see a lot of people using it. This is a great way to stand out. So if you haven't followed us, not too late to do it. You'll find out about all the exciting events coming up. They do this event 2 times a year. They do it here in Dubai. They do it in Las Vegas as well. So there's another event just starting on Monday, which is going to be great. And I want to make sure that you guys have everything you need so far. Okay, you guys having a good time? Everyone's awake, had their coffee? Fantastic. All right, well, we're going to get started because I see those panelists started talking already. I have a feeling there's some really good content that they're going to bring up to the stage. So the panel discussion that starts the day is we're going to be learning about the most common chronic diseases and conditions that are affecting seniors. Whose parents are over 60, 65, I think is the age, right? Okay, so we got a lot of people in the audience. This is going to be really relative. Personally, I have a mother who's in an assisted living facility. So when it comes to when we start deteriorating with age, this is going to be really, really interesting to find out how these conditions are affecting seniors, how they can be managed from the comfort of their homes. So without further ado, I'd like to invite to the stage our panel moderator, Dr. Sora Rowas, co-founder and CEO of Sorat Consulting. Give her a round of applause. We're going to keep it exciting. She has our first panel discussion. I'll let her bring up her team of panelists, okay? And I have microphones for everybody. Great. Okay, everyone knows already? All right, then let's just call everybody up. I have Dr. Wisam up to the stage, please. Dr. Sora, she's here. Dr. Pranay, Jobin, and Jignesh. Come on up. First panel discussion. I know they'll go around and give you a little bit further intro of everybody who's coming to join us on stage. Again, please turn your phones on silent so don't have rings throughout the sessions. And if you need to have a conversation, I advise you just do it outside the room, so because we can hear everyone's voices with this big room. Good morning, everybody.
Good morning, everyone. Thank you for joining us so early in the morning for our panel discussion. After discussing with the other panelists this morning, I'm really excited about the conversation we will have. I'll start by introducing myself, and then I'll ask every one of our esteemed guests to give a brief introduction about themselves. Today, we will first contextualize why this is an important topic and why all of you should be paying attention to in-home care of chronic disease management. And then we will focus on the challenges that currently faced in home care, as well as how we can help technological solutions come from the bench to the bedside, both success stories, some failures, and hopefully some future outlooks on how this can look in the future. So I'm Sora Rowas. I'm an internal medicine consultant. I've worked in multiple countries, and I assure you, regardless of the differences, when it comes to patients and elderly care, the challenges are more similar than you think. I love the context that Rachel gave us about our elderly and aging parents. So as a clinician, I worked in primary care and hospital medicine. I worked a lot with elderly patients, and then I moved into the consulting space where in change management, we're no strangers to the challenges that can face, how you can improve the process of healthcare, specifically for our vulnerable patients who are elderly. Please, Dr. Wisam.
Thank you, Sora. My name is Wisam Yassi. I'm an imaging cardiologist based in the Netherlands. My daily work consists of daily patient care and advanced imaging. We started 2 years ago with a company called the Med Company, and we created a telemonitoring app with the guy sitting back there, our CTO, and our guy in the Middle East. So he can manage everything, even buying a flying carpet. So everybody needs one, please contact my friend back at the end. So I'm gonna pass it to you.
Thank you, Wisam. I'm Jobin. I represent Tibet Life Sciences. I have an engineering background, about 2 decades of building systems in robotics, and then 7-8 years back, got to work with a healthcare company to build medical devices. From then on, it has been very exciting to work with building medical devices and devices for diagnostics. Nice to see you here. Good morning to all. Pass to.
Good morning. I am Pranay, the founder of Healthkon, a company or a startup that builds health and medtech solutions and solutions that sit on the intersection of both of them for providing, from a home healthcare perspective, we have a step-down intermediate care device which is connected to a kind of a solution on the mobile phone which helps bedside monitoring for critical patients at home. Thank you.
Good morning, I'm Jignesh. I'm primarily from a health insurance background and finally made the switch to a health tech company earlier in the year. So I'm based out of Singapore, currently the Chief Operating Officer for Smartfuture. What we do is we connect medical devices through wireless technology and make their medical vitals accessible remotely. So it started with a simple health kiosk, evolved into a telehealth pod, and finally now into remote patient monitoring solutions, be it for home-based care or even from a hospital management perspective. Thank you.
Fantastic. So as you can see, we have innovators who are really passionate about improving in-home care. So just to contextualize today's conversation, why should we talk about in-home care? So those of you who were here yesterday, you know that some people mentioned that we have an aging population. Chronic diseases have an increasing burden, mainly because people are living longer. Also, we simply don't have either enough hospital beds or enough healthcare providers who can take care of the increasing disease burden in hospitals. So in-home care becomes much more important as a solution. But another thing to really pay attention to is that so far data shows us that we have improved clinical outcomes. Hospitals increasingly are not the safest place for elderly patients. Issues like delirium, which is confusion, someone mentioned bed sores earlier, which we'll talk more about later, as well as the loss of the support system, make hospitals really unattractive places for elderly patients. So you should really pay attention to this conversation, because it really highlights the future of healthcare, and it will hopefully change your idea of what good healthcare looks like. It is no longer a doctor in a hospital bed at the bedside, but hopefully it is a patient being taken care of at home with their friends and family and support system. So with this background in mind, I would like the different panelists to highlight from their perspective what really drove them to focus on home-based solutions. I think the motivation and your own inspiration is important context.
Shall I start? Thank you very much, Sora. Maybe I'm gonna break a few numbers to you all, just to create a perspective what we are talking about and why. I work and live in the Netherlands, small country, a bit less, 80 million. Our system, health system, praised to be one of the best in the world, currently number 3, after Germany and Switzerland. So if we break the numbers between 2020 and 2040, only the financial burden of cardiovascular disease, which is mainly chronic heart failure, it's gonna be 23 billion a year. It's with a B. 23 billion in 2040. Concerning the working force, right now, from the working population, we have 1 of 7 working in the health sector. In 2040, we need 1 of 3 to work in the health sector, just to sustain the current system, which is not sustainable to any economic and any health system. This is the driving force for innovation, and not innovating tomorrow, but innovating now. And we should transfer health care to the local environment of the patients as much as possible to reduce patient presentation, unneeded presentation to ER, admission to the hospital. Just like Sora said, as a clinician, as an internal medicine department, she knows that not every admission to a hospital is a positive thing. The only way to do that we think an integrated telemonitoring system, health system, in which as much as possible we can provide optimal care, guideline-based, at home. And that was actually my driving force to create, together with my friends, the Medcore4U app. To provide telemonitoring with one app, which is very simple, with a very simple patient interface, a one-button operating system to a wide range of patient and user cases at home.
Hi, I can talk from an Indian context. 20 years back in India, home care was not really discussed. I mean, I would say when I was younger, because, well, people were at home, people had chronic illness at home, but it was not bothered. They don't bother much because there is anyways a lot of people, I mean, families around. But at the same time, the quality of life for a chronic patient was not really looked at for different reasons. And as time progressed in the last 5 to 6 years, things have changed a lot, and families don't stay together anymore. I mean, kids are mostly out of the country or in different cities. And at the same time, people start looking at whether you can give better quality of mental state or better quality of life for that person who has a chronic illness. There are a lot of healthcare personnel available, but at the same time, the quality of training for that healthcare personnel is not up to mark. And at that point is when we should look at technology coming in to aid the healthcare personnel to some extent, where there are certain set of quality aided by the technology given to the person who has a chronic illness. So that is where it is. From an Indian context, the numbers are very high, even though the ratio of old age people are not very high, but the absolute numbers are very, very high. And we can't have that kind of support person also. So it is very important that healthcare, in-house healthcare should be aided by technology to a very large extent. Pranay.
Pranay.
Thanks. So you've already given a sort of a curtain raiser as far as the Indian context is concerned. I come from the same region, same problems. I, of course, being an entrepreneur and I having identified that there was a huge gap between the hospital and a patient. So when you want to be looking at patient-centric care, we want to be making it very comfortable from a patient perspective. Because now when you look at medical healthcare, and to the point of raising a controversy here, the patient is the one who's consuming the service, and he or she can pick and choose. He or she may want to have home care delivered, go to an ambulatory clinic, go to a hospital, meet the specialty, and of course, I completely understand various countries, developed nations, have insurance-driven care, which is paid for. But there's out-of-pocket expenses as well. As far as India is concerned, since you brought out the context here, predominantly out-of-pocket. So when you are giving money out-of-pocket, then you want to be buying the best. And given your personal needs, you may want to be treated at home now for your parents, like you brought out, and kith and kin. So what I realized is that if home care has to be delivered, it has to be delivered in a sort of an intermediate, but critical care. When we talk about critical care, then I thought of intermediate care. So you have a home nurse, and then you have elderly people who are going to be monitored in a lesser frequency, but have a solution that fits by their bedside, is available to the doctor remotely, is mobile first, and connected seamlessly. So that's really what I realized, that this is going to be the solutions going forward. And we've developed upon making it easier for the remote doctor to be able to have an encounter with the patient at home as well. So that's kind of seamless. We've got med tech here, we've got health tech here, we've got SaaS, we've got insights from various artificial intelligence and all of that, just to make sure that there is an end-to-end value-based care, as we talked about yesterday. So, yeah.
I have a comment, because you highlighted something very interesting. When we think about chronic disease management, we tend to think about patients who are able to go to the outpatient clinics and who are able to go to the outpatient clinics. As our patients get older, as they get more vulnerable, as we're able to take care of more frail people at home, you've made a very interesting point, which is even acute care can sometimes happen at home, which is actually for the benefit of the patient, because it takes away the risks of hospital-acquired infections, it takes away the loss of support system that comes with going to the hospital. So as we improve our game in chronic disease management, even acute care can show up at home, and I think that is a future I want to advocate for our elderly.
I think spot on. So the reduced rate of nosocomial infections, and combine that with a mental and social support and a familial surround, nothing can match that in terms of a patient getting treated or recovering in a hospital setting, especially in a acute or chronic setting. Having said that, there's enormous progress made, but if I have to kind of contextualize a bit of my experience working in the industry, it all started with health kiosk, and it used to be positioned from a prevention perspective. And at that point of time, it was literally a lot of cold calling and convincing various stakeholders. And there was no respect, there was no appreciation in terms of what we wanted to achieve. And at the most, what we would get is, on an average, maximum a 4-week program where the kiosk would be deployed at the corporate site, and it would be like the HR is doing a favor to us, and even then, the employees had to be pushed just to take the vitals. So with all the right intentions, the company would deploy these health kiosks, and the employees, the participation wouldn't just come in, and it would be for a variety of reasons, right? In terms of their data, privacy, so on and so forth. Comes in COVID, not only does telehealth, the adoption kind of accelerates, but brings in its own solutions. So it eventually now got evolved into remote patient monitoring. The problem or the biggest challenge here is, for a lot of markets, unlike say a US, there is no proper guideline or a framework. So everyone wants to talk about or wants to put in place a chronic disease management program. What does it actually entail? Is it, for how long should it be? What is the kind of investment that needs to go into it? What is the kind of participation from different stakeholders that is essential? It is not only on the medical device company or the health tech company to make it successful. Obviously, there's a vested interest, but it is essentially also up to the employee or the patient or the user to be as much a part of it. And from a tech side, there's so much of an evolution that you have companies specializing in just throwing in educational content. There are alerts, and sometimes you just feel there's just too much. Let the person live, right? So in that sense, there are polarized views as well. But I believe health tech is here to stay. In fact, it can only accelerate. It is up to us as to how we can benefit out of it. And of course, there's a whole lot more that we can talk about the use cases.
You've highlighted some really amazing points. It's a beautiful segue to the challenges, which we're going to spend some time talking about. But I really want to highlight that and Pranay also highlighted the same thing about patient empowerment and how the patient has to be in our crosshairs, at the center of our focus when we talk about any innovation. But you've also really mentioned something really important, which is that it's overwhelming. With chronic diseases, the amount of medicine, the amount of data that is out there is overwhelming even to healthcare professionals. So how can we help patients sort of make sense out of this new situation, often a new diagnosis, but even old diagnoses like patients with diabetes or heart disease or hypertension, high blood pressure. These are all things that are lifelong illnesses. So how can we help this patient at home live well and not live through the lens of disease, but live through the lens of well-being? And then finally, you talked about prevention, which historically, when I first went into medicine, the cost of prevention was always one of the big factors that people talk about in terms of, is this cost effective? If we're going to recommend a certain preventative or screening test, is this going to be cost saving in the long run for healthcare systems? But now with technology, the cost of care and the cost of prevention is so much lower. Everybody has a phone in their home, right? And you guys will talk a little bit more about that. So maybe monitoring and detecting things early is not as impossible as it used to be back in the 90s. So now with this context, I would love for each of you to talk about the challenges that you see currently and that you've either faced in your own experience or you've observed in terms of improving in home-based chronic illness.
May I kick off?
Please.
Well, it's a great talk and insight, guys. Thank you for that, Sora. Great. Well, I can talk about the worldwide experience, so I'm going to talk about our local experience, what we did. Because of the challenges, we started actually to write a protocol at the hospital, mainly for the cardiologist treating chronic heart failure. But we did that together with our specialized nurses. Because of the nurses, if the nurses are satisfied, the patients are satisfied. So we made a workflow to reduce actually the burden on both sides of the patient side and the healthcare side. To shift the idea from being ill to being healthy, but live with the disease. And then we manage the number of measurements, because we have to change from garbage in, garbage out, to quality in, quality out. I think this is the best way to write a protocol, to communicate, to tell the patient what to do, and if something happened, then we can intervene. And when he can call like the emergency department or the family doctor when needed. So this line of communication is very important to get the most of it. Why we did that? The percentage of the cardiovascular presentation at our hospital varies between 11 and 13%. 80% of those coming to the ER are going back home the same day. The only difference, they spend 3 to 4 hours on the ER. And
How do patients deal with that? Do the patients feel like this is good care when they get discharged the same day? As an internist, we face this challenge of even when medically they should go home.
This is very true. I don't want to give you a headache about the ER during the COVID, but the current situation, we need to convince the patients to go home, but most of them, they want to go home. Most of the patients, they come for reassurance. They felt something, we couldn't take a decision, we let them come. So if you can take a measurement, just before I left, it's a very personal story. One of the people using our app is my mother, actually. And she has a rhythm disturbances. She went with the family, and then she didn't feel well. My father called me, what are we going to do? I said, just measure the blood pressure and the heart rate, so I knew she's in AFib. So I told her, please take an extra medication, and then measure it after an hour.
AFib is an irregular rhythm of the heart.
Yes, sorry, thank you very much. And after an hour, everything was normalized. One call, one extra tablet, which cost about 5 cents, prevented any ER presentation.
Thank you. So, Jobin, you're a hardware guy. So what challenges have you faced in terms of the design of home care solutions? Do you want to talk a little bit about that?
Well, it's actually very challenging because there are multiple types of multiple problems we are trying to solve here. We can start from what exactly are you trying to solve, all right? So to a large extent, a lot of people like to be independent. Mobility is one of the primary concerns that people have. People love to be independent, right? We don't want too many people around, and don't want to be dependent on your sons or moms for every little thing that you want. So from a mobility point of view, it will be to move around to do a basic task like going to the toilet. We were discussing that some time back. To enable that, you have to understand what is the kind of illness that you're dealing with, right? I mean, different people have different conditions, and it is difficult to standardize one equipment, one way, one system in which most of the chronic care can be integrated to. It is very difficult. It starts from designing a toilet which may need a flexible plumbing because your height may be different. You may need different heights for different translations from one position to the other. So that way, also to look at standardization of communication. I'm talking about communication between devices. I'm talking about communication protocols between equipments which are built by different manufacturers. Let's say we have 10 manufacturers in the world who are building 10 different sensors for the body. And then let us say I found one company which has a very good posture detector. I know what posture you're lying in, but I want to use this in line with the other hardware which will connect to the doctor. No, it is not compatible anymore. You can't connect these two devices together.
I want to quiz you more about that. And I'm sorry, I'm a layperson when it comes to technology, but I think it's a pet peeve that we can all understand. Why do manufacturers do this? Why don't we have standardized ports, standardized connections, standardized ways of allowing different parts from different companies to work? Like, for example, why do I have different chargers for different phones? And so on and so forth, right? This is part of the design.
Yeah, it's very interesting. It's very something that we have seen in the industry back in the day. If you look at the old car, let's say 20 years back. If you want to change one car stereo to the other, we had to rip up all the wires and connect everything, which is very difficult. Then people realize that it can't work like that anymore. That is when Bosch invented the CAN bus, which was a standard protocol. Now, the point is that for any common protocol that we use, including the USB for that matter, USB is part of the USB consortium. So a lot of companies came together and said, look, we can't live like this. We have to come together. And that is how USB was formed, so that now every device comes with a USB. Similarly, Bosch started with CAN bus, and a lot of companies came together and said, look, let us make cars simpler. Now I can buy any third-party equipment and fix it into a car just pressing into the socket. We don't have to cut wires, we don't have to do anything. Similarly, our devices do not have this at this point of time. So what we need is a consortium. But then consortium also turns to mafia most of the times. That is what happened to the light bulb back in the day. So we need a good consortium. Good set of people with a standard protocol, a good understanding about what is really required. Look, if you look at it, you have watches, sensors everywhere, and most of it is communicating through Bluetooth. But it's not a good idea, because Bluetooth can have latencies, right? You need to have a heartbeat in the hardware, which say, look, are you working? Are you working now? Did you fail? Did you fail? So it has to come back and communicate. Wireless systems are not exactly good in doing that. It will take a longer time to understand that the other part has failed. So you need to come up with an idea, a good set of people with larger power, resources, and come up with a protocol. This will be the biggest challenge. But if this happens, then you can have multiple companies making devices, any type of devices for that. Right? It can be a monitoring device, it can be a blood pressure monitor. We can communicate, just plug into the standard port, and the doctor can see all these devices.
Win-win, right?
Yeah, it's a win-win for all, yeah.
Thank you. So Pranay, your background is in the aviation industry, and I know, even from my own training, I know that you guys taught us about redundancy and safety and the Swiss cheese model, but as someone who's jumped from that into healthcare, can you talk about the challenges you faced, and how does it compare to your old industry in airlines?
Yeah, that was googly that I'm going to be answering. So sitting on a panel in health and talking about aviation, but good question, great question. So we come from a mindset, given that one's an aviator in the past. You're flying machines. And when you're flying machines, then you kind of always standing by for something to fail. So that's really what helped me when I, as an entrepreneur, started to have sort of solutions design. And when you think of from a design thinking perspective, you're looking at the user experience. You're looking at a mission critical approach. That's really when we talk about the Platinum 10, the Golden Hour, or being managed to save a life. So the whole focus would be on how things could go bad, but there should be a recovery path, and how that could be positioned at home. So that exact philosophy actually drove design thinking to bringing about a solution where, from a user experience perspective, it was minimal interference, because here you're talking away from a hospital or a very formal hospital environment. You're talking home care with home nurses, maybe family, extended family who's kind of jumping in. We heard the story of your mother. And obviously, so there's got to be somebody at hand. Need not be a nurse, but it's got to be easy. It's got to be less complicated. All of the complexity that Jobin brings into this whole world needs to be in the background.
So tell us more about, because I know you have success stories,
Yes.
but there's no success without failure and
Yes.
challenges. So can you tell us some of the difficulties you faced along the way before you got to the success?
Yeah, so the difficulties come from not being able to understand the patient journey and the doctor journey, and then mapping out those intersections or the points of intersection where you kind of build a seamless sort of a workflow. So those challenges were worked out over time with clinicians, with nurses, with attendants, tech, and all of that. So it takes time. like it says, you patience and perseverance when you want to get into this, though it is the buzzword of tomorrow. But kind of pain, and you put yourself in the shoes of the patient all the time, as well as the doctor. If you put yourself in their shoes, of course, not undermining the caregiver at the point of care. You map these three guys out, and then you can see constant refinement to get to the
I love
right
that
place.
answer, and honestly, I want to highlight that I think that's why you have a success, because as someone who, both when I was in clinical medicine and as a consultant now, I see a lot of products that are out of context of what we actually need, both from a patient perspective and from a provider perspective. So I would recommend for people in R&D, please engage your stakeholders. This is how you will become successful.
Well, it's real. I didn't make this up. In 2020, after the first wave of COVID, the hospital asked me to look for a solution. So, as you know, I won't name them. We have a very, very big companies, tech companies in Europe, one based in the Netherlands and the other one based in Germany. So, I won't name them. So the guys from Germany came with a very fancy
Here's
suit,
their address.
and they show us their system. And it was like a home telemonitoring with an app and the devices. So they were very, very, proud to show us the prototype. And then I looked at it and I said, wow, you have only Bill Gates in your outpatient department. I don't have that. Where do you find these patients? He said, we never saw a patient. So you know what's my patient population of the heart failure outpatient department? They are 70 plus. They would never use this product. It's far too complicated. And they didn't see that. And actually the whole program shut down after a few months because it was totally disconnected with the reality.
So Jobin, I'm going to invite you to do some, Jignesh, I'm going to invite you to do some controversial discussions about your
Has to be me.
financial challenges as someone who's been in the insurance industry.
No, so I think taking that experience aside, all of us have seen a spurt in health tech companies. I think the question is, 3 or 4 years, name a few companies that come to mind that have been wildly successful in the home monitoring space. I can't think of any. So it's something clearly food for thought, right? So there is a gap, not that companies are not being innovative, companies are not addressing the issues. Probably something somewhere is falling apart. And to me, that is the biggest challenge. From my experience, I think what is working for us, or what has worked for us so far, is the fact that we've kind of adopted a agnostic approach in general. So be it the types of medical devices, or be it the cloud solutions, or be it even the EMRs that needs to be integrated with. Rather than just monopolizing, or rather than just sticking to just one size fits all solution, it just doesn't work. There is so much of customization, even within the same clinic or even within the same hospital. There's so much of customization required, and I think that is what is essentially keeping us going. So that's one. 2 is, in terms of the use cases, I think it's evolving, right? One of the more recent cases is emergency responder kit, not only for home base, but it's now being positioned even for schools, where a device like an ultrasound is being part of that solution of that kit. And usually fractures are one of the more common occurrences during these field trips. And the idea of first taking...
They sound like adventurous field trips.
Oh, there are a lot actually. at least in Singapore and around, where they essentially go for some treks and stuff. And again, this could be remote areas as well, where the point of care, be it a hospital or A&E, may not be easily accessible. So the idea is to first use these devices, get the staff or the children to kind of stabilize them first, and then eventually triage them smoothly in the hospital. So I think the point I'm trying to highlight is there's definitely a use case, and it's evolving, but at the same time, we cannot take away the human element that is necessary along with tech.
I have a point. I want to bring in a perspective, more from an entrepreneurial perspective here. We've got, the more medical and the hardware perspective. So here's a little bit of a business element that comes in because we've got a couple of people here. The bigger companies that you highlighted, this is a very small business case. Like we brought out very clearly here that this is an evolving market. Now in an evolving market, either you get ahead or like he said, you force fit it with what you have. Like a one size fits all, put it there, plug it here, kind of stuff, bits and pieces stuff. But if you're really wanting to look at how this evolving market will have its needs met, that's really when you start looking at open innovation. And since we're a whole congregation here of innovators, while being specialists in our own fields, this is a call to action for innovators to start building solutions like Dr. here did, like probably you doing, I'm doing, he's doing. But it becomes a sort of an open innovation for the bigger players to sort of look at these innovations and then put them across and use cases across. Because you've got to be a little in step with the future.
I think I want to highlight something else to piggyback on what you guys said, which is it's hard to create a standard for patients who are so diverse. When we talk about chronic disease, when we talk about the elderly, even our concept of aging, not everybody who's over 70 looks the same, right? You have 90-year-olds who surf, and you have 65-year-olds who need a lot of care at home and are quite frail. So the cost of research and design can be quite high, and the cost of customization, when we think small scale, can be quite high. So you've all very rightly discussed how it makes it really difficult to create solutions that will still be profitable down the line, because as you said, from a business perspective, if it does not make money, it will fail. Someone has to pay for it. So I guess let's brainstorm, in this next portion of the panel, how can we get the funds to do research and design so that we can bring to patients what they need, which is tools and methods to help them be independent at home, bring to providers what they need so they can take better care of patients with, as we've already discussed yesterday, we have a decrease in the number of providers and we have an increase in the number of people with chronic illness. So how do we bridge this gap? And our only hope is technology from where we lie right now. So what do you recommend? And this is for all of you, whoever feels excited to answer it. What do you recommend? What's your advice to yourself and others in your shoes who want to bring high-quality designs to the bedside and not just keep it as an idea?
Can I take that up first? So it all boils down eventually to who's going to pay for it, whether it's affordable while all the technology is out there. And it's so isolated that most of the markets that I'm aware of, insurance doesn't even cover for it. So to me, making that mainstream, and by now there are enough clinical studies coming out, may not be to specific markets, but it definitely in evolved or developed markets, there are enough clinical studies coming out in terms of the benefits of having these use cases. So why not make it mainstream? Why not include it as part of the insurance coverage itself? Telehealth, for example, in a lot of markets, it wasn't covered for the longest time. If we just go back in time, the beginning of COVID, and that's where a lot of companies started offering. From an insurer perspective, the fear was that there could be a massive abuse, for a variety of reasons that the users can, and they will eventually bear the brunt. And in some countries, it actually has. But majority of them, it has proved to be more beneficial than otherwise. So I personally would want to see this getting mainstream as part of the insurance coverage, for one. And for two, there has to be customization. Companies venturing the space, they need to be ready for customization as much as is required, and to it is important to work together, not only with the medical devices company, but also with the hospitals, providers. It has to be consistent. There has to be a proper framework for it to be successful.
I agree, and I think I want to highlight again, I know we brought this up yesterday, that I think our hope is in value-based care, because you want to get the people who will benefit from the well-being of the population together. When you think about an insurance company, even though everybody likes to hate on them, but an insurance company benefits from people being well. It benefits from people being well with a low cost of care, right? And the idea is only those who really need it. Only if someone gets sick, then it'll cost more. So who also benefits from being well? The patient population. So how can we align the interests of insurance companies and patients and I think and hospitals, healthcare systems, and the way I see it, and this has already been pioneered in the US, it's value-based care. Because then the money exists. It's a matter of getting the money to serve the right people in the best way where everybody wins. So are we running out of time? So final thoughts?
Final thoughts, yeah, definitely.
Okay. So I guess we have some clinicians and some innovators here. What do you want to see more from each other? So if you're in the tech space, what do you want clinical providers to know that you feel that they don't know? And if you're a clinician, what would you want people in the tech space? And you've covered some of it, but this is your opportunity to highlight that.
Shall I comment? Well, I think the main thing is collaboration, once again. We should meet and talk and see each other at work, actually, what is possible. And you guys, you should come and see our patients, and you see the context. And I think we should come and visit you guys and see what's possible. Collaboration is the only way forward, in my modest opinion.
So I think, adding to that, I agree to Jignesh's perspective, what he said, one size fits all. I think when we talk, the innovators talk to the doctors or people who had a problem to solve, it has to be more specific. Be very specific. I mean, you can't have one solution for everything, right? Like, again, going back to India, we have the phone, mobile phone, which does everything other than to make a call. The call drops all the time. So the phone was to make a call. That doesn't work. So we don't have to put a Wi-Fi in everything. That's my point. So we have to be very specific and solve that particular problem, and things will fall into place.
From an absorption perspective, we're actually growing a new segment. Say that? Hello. Yeah, so from a provider perspective, we're actually growing a new segment of providers. So my interest would lie in how will you provide the service in a seamless manner for that home consumer to be able to consume the service. So you have to build that ecosystem where you have a doctor on call. Obviously, there will be cascading sort of workflows out of the hospital, but how does a patient get home care? That would be a question that needs to sort of evolve and kind of get absorbed or standardized. Yeah.
Fantastic. Yeah, I know there's one more thought. I'd love you guys to have
I'll
your
make
thoughts.
it quick. So I think so mindset, and affordable. Thank you.
Hashtag, right? Hashtag affordable. Give them a round of applause. Great panel to start out the day. Look at this, a room filled up with these guys. Fantastic. Really appreciate you guys taking the opportunity to share that information and insight. Thank you. It was very valuable. We're going to do a picture with the group up here. Anyone in the audience have some questions for them? We're a little running out of time, so I see some hands up. We have all day to engage, right? I just want to make sure that these guys see your hands so they can address and make sure that they can, answer your questions that you've brought up or that you're going to bring up later in the day, and it may have to be during the networking time, okay? So I appreciate that. We did get started off on a little a delayed timing, just we wanted the room to fill a little bit more. And here we are, we're streaming live on YouTube so that people around the world can see. Started a great panel this morning.